Hello everyone, I'm with Enroll Wyoming. Enroll Wyoming is a organization that has been tasked with the state of Wyoming to travel around and educate people on the Affordable Care Act and the new law implications and how it may affect you and your family. So Enroll Wyoming, this is our little mascot. We call him Bandage Boy. No medical health insurance. Don't let medical costs beat you up. So if you see this around the state of Wyoming, just know that they are trusted individuals that you can go to with your questions and concerns and even help with enrollment. So in this presentation, we're going to go over it's a general overview of the SHOP marketplace. We hope the outcome will be in the overview of the Small Business Health Options Plans, in short it's SHOP, and Business Affordable Care Act mandate. And we hope you'll know where to go for additional assistance at the end. So starting in 2010, when the law was originally signed and passed, starting in 2014, everyone must have one of these three things. So they already have to have a minimum essential coverage, and that can range from Medicaid, Medicare, TRICARE, veterans benefits. If you already have employer-sponsored coverage, there's a whole list on healthcare.gov if you go and type in minimum essential coverage. One of the other things is you may qualify for an exemption. So also on healthcare.gov, if you type in exemption, you can search for an exemption that may eliminate some of those. We'll get into the tax penalty for you. And the last thing is that tax penalty. If you don't already have minimum essential health coverage, if you don't qualify for an exemption, you will end up having to make the shared responsibility payment, which is also that tax penalty at the end of the year when you file your taxes. So the essential health benefits, there's 10 core essential health benefits that all plans on the marketplace offer within their plans, or have to offer within their plans. Some of them are outpatient care, their emergency services, hospitalizations, maternity and newborn care, which is kind of new to some plans. Some plans used to be able to exclude that. Mental health and substance use disorder services, including behavioral health treatment. This is another one that is new as far as it has to be in the plan. It used to be optional. Prescription drug coverage, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, chronic disease management, pediatric services, including oral and vision care for all children. So what is the SHOP marketplace? So SHOP stands short for Small Business Health Option Programs. So it's a streamlined way for small employers to offer health insurance to their employees if they want to. It offers access to qualified health plans that meet minimum value and provide essential health benefits. Those are the 10 essential health benefits we just went over. It removes barriers to offering health insurance, including lowering costs through tax credits, which we'll get into more detail about here in a little bit. So less than 50 employees, this is full-time employees. It's optional insurance offerings. So this means if you have less than 50 full-time employees, you do not have to offer health insurance to your employees, but it is an option. And you also do not, if you do offer insurance to your employees, you do not have to offer to the dependents and spouses. It's a new Wyoming state law where, as before, if you offered it to your employees, you had to offer it to dependents and spouses. That is no longer the case. With employers with 50 or less full-time employees, there is possible tax credits, which we'll also get into more detail about here in a little bit. And it's no longer a requirement to offer coverage to dependents, as I mentioned before. And you must offer the same plan options to all employees. This is not so you can so you don't offer, let's say, the manager of your business a higher plan than the other employees. All plans need to be available. The same plan needs to be available to all employees across the board. So who is eligible for SHOP? To participate, you must have a principal business address or primary work site within the state. So let's say you live within the state of Wyoming, but your business is actually in Colorado. You would have to go through the Colorado SHOP marketplace in order to look at options for them. But if your business is in Wyoming, and even if you live out of state, you need to sign up for SHOP within the state where the primary business address is. You have to have at least one common law employee on payroll, not including business owner, spouse, or sole proprietor. So if you have a business and the only person that works with you is your spouse, you cannot go through the SHOP marketplace. You'd have to go through the individual marketplace for a family plan. But let's say it's you, your spouse, or it's just you, and you have one common law employee that's not a relative. You can go through the SHOP marketplace. You have to employ less than 50 or fewer full-time equivalent employees, and we'll go into that. Let's say you have 40 full-time employees, and they describe a full-time employee here on the second line. You'll see is 30 or more hours per week. But let's say you have 2 part-time employees that average 15 hours a week each. That is considered one full-time employee between the two of them with the hours. You have to have a 70% participation rate with eligible employees outside of open enrollment. We will go into what dates are for the open enrollment period for SHOP. This is if you offer a SHOP plan to your employees. Let's say you have 10 employees, 70% of them, or 7 of them, have to have to pick a plan through the plans you're offering them. So the employer tax credit. There's available tax credits for employers with fewer than 25 full-time equivalent employees. Those employees, the average wage for all those employees has to be less than $50,000 per year. You have to pay 50% of the employee premium. If you have 10 employees or less, you can reach a maximum of $25,000 in tax credits. And this tax credit is available for 2 consecutive years. So when we say think about tax strategies, if you're thinking about going through the SHOP marketplace, you maybe want to think about doing setting up a plan that would start at the beginning of the year, so you can take full advantage of those tax credits for the entire year. Instead of maybe the middle of the year, you'd only have those tax credits for half of the year. And this is a good time too to also sit down with your accountant to go over all your employees to make sure you also meet the average salary or wages for your employees and make sure they're under $50,000. The amount of the tax credit, you can get up to a 50% tax credit for employers' single coverage premium contributions, and up to 35% of the premium contributions for a tax exempt employer, so nonprofits. So plans on the SHOP marketplace. The SHOP will offer choice of insurers, qualified health plans, and financial protection levels. So all health plans must offer essential health benefits. Those are those 10 core benefits we went over. Plans must be affordable. Plan choices are grouped by metal level. There's bronze, silver, gold, and platinum. And here you can see the bronze plan, they have to pay at least 60% of the plans, and then the employee will pay 40%, and then of course it goes up to silver, which is a 70-30 plan. A gold is an 80-20 plan, and platinum is obviously the highest with a 90-10 plan. When looking at this too, it's not on here, but the bronze plans, you usually pay a lower premium, but you pay more out of pocket when you go to receive services. And then the platinum plans, you pay more in premiums, but less when you actually go to receive those services. So some additional information: you have to offer the same plan options to all employees as we mentioned before. You can have for new employees, you can have up to a 90-day waiting period for them. Enrollment is throughout the year and renews on the anniversary date. So you can sign up for SHOP anytime during the year. Again, it's all about kind of your tax strategies. If you're available for tax credits, maybe it's better to do it at the beginning of the year. But the open enrollment date is November 15th through December 15th. And if you just sign up during that time, that 1 month period, you don't have to meet that 70% participation rate. You can have, let's say you have the 10 employees, but only 5 of them want to take it. You don't have to meet the 7 employees to sign up for the SHOP plans that you're offering. So how the ACA relates to large business owners. So there's two business categories. So there's less than 50 equivalent full-time employees, FTEs, and that's optional insurance offering. Fewer than 25 employees, you can get possible tax credit. And we're not going to go too much into the large owner part, but if you have 50 or more equivalent full-time employees, the ACA mandates that you offer health insurance to all your full-time employees. So a plan is affordable if employees, the share of the annual premium, so that's with the contributions if you're doing contributions, for the lowest cost self-only plan is less than 9.5% of the annual household income. So whatever the family's household income is on line 37 of their taxes, if the annual premium of that is higher than 9.5%, so they're paying more than that, it is considered unaffordable. And this is for the employee self-only coverage, 9.5%. And then for the employer, the employee's share of the annual premium for self-only coverage is less than 9.5% of wages reported in box 1 of the W-2. A plan meets the minimum value standard if the plan's share of the total allowed benefit costs covered by the plan is no less than 60% of costs. So what is the bottom line? So you have to offer affordable qualified health plan. If insurance is available, not every employee will take the offer. Therefore, the cost may be more palatable than first expected. When we talk about this is, let's say you have those 10 employees and so you're outside of the open enrollment period and you have to meet that 70% participation rate. Let's say that 2 of your employees are on Medicare. So you don't put those 2 employees onto your calculations to meet that 70%. So you have to meet 70% on 8 employees. Or this is the same if it's, one of your employees, they get coverage through their spouse. You don't count them in that participation rate outside of the open enrollment period. And it's good to think, if you're going to offer health insurance, offer a good comprehensive plan. Again, if you're under 50 employees, you don't have to offer health coverage to all your employees. Sometimes we've met some employees or employers that have offered a plan because they thought it was required them, and they don't offer a good comprehensive plan. If you don't offer a good comprehensive plan and it's still affordable for the employee, it really throws them in a loop to be able to go out on their own on the individual marketplace and receive tax credits that way. So some additional information, there is a shop calculator. This one, this first link here is for the full-time employees. You'll put in all your employees and all your part-time employees, and it'll calculate how many full-time employees you have to see if you're, let's say you're under the 25 or if you're under the 50% or the 50 employees. Then you also have a premium estimator. This is if you're thinking about entering the shop marketplace, you can put in some of your general information on your employees, and the marketplace will spit plans back at you on what those premiums would look like. And you can also put in the number on how much you want to contribute to the plans, so it shows how much the employee will pay for those plans. And if circumstances change during the year, you will still remain on your present policy. It's until your anniversary date, and then if you're over the 50 employees, see, the example is if you grow larger than 50 employees throughout the year, you won't have to automatically hit that mandate, but it'll go till the anniversary date, and then you'll have to rethink about your options. So where do consumers go? Again, we are with Enroll Wyoming. We have a list of events on our website. If you go to enrollwyo.org, we have a link to Wyoming 211, which is a calendar with listed events around the state of Wyoming that you can attend. The health insurance marketplace is found at healthcare.gov. We always emphasize the .gov because healthcare.com does sell health insurance, but it is not the website you would go to for those tax credits. And then shop employers, there is a call center if you're interested. Their hours are 9 a.m. to 7 p.m. Monday through Friday Eastern Time. And if you have any additional questions, if you call Wyoming 211, they are a referral service that can help with all kinds of questions. They are also trade navigators that can answer some pretty general questions and some in-depth questions as well. But if you want to sit down with an in-person navigator, they can arrange for one of us to call you and meet with you. Also, Enroll Wyoming has a Facebook, Twitter, and Instagram page, and we update it with news and information for the consumers if you are interested. Thank you.